Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan and today we're going to discuss the condition which is known as strabismus. So it can be defined as a pathological condition from which the eye is suffering. It can be a unilateral or a bilateral condition. And basically what is happening to the person is that he or she is unable to align the eyes, both of the eyes, when he's looking straight at a fixed point. So this is the basic underlying pathology when we say that a person is strabismic. So over here in the very first section, we'll be going about and defining what is strabismus, what are the particular causative factors towards the development of this condition. This is again very important because whenever we are classifying this condition of strabismus, it can be according to the causative factors that will basically relate towards the underlying foundations of the pathology in which it is basically causing or going out towards the misalignment of the eyes. So over here, we'll be also discussing the classification according to the incidence or according to the prevalence. Again, we can categorize this condition of strabismus into a congenital condition as well as, on the other hand, it can be an acquired condition which is basically relating to the strabismic condition in the adults. So we'll be again looking at the causative factors, particularly in the children, whether it is a by birth condition or it is developing along with time. What are the conditions that are basically making the person more prone to the development of the strabismic condition? On the other hand, when we say we have strabismus in the adults, we'll be defining that as well over here. The risk factors will be discussed over here in detail, making the person more prone to the development of this strabismic condition. In the second section, we'll be giving you the types of strabismus. We basically give out the terminologies of exotropia, and on the other hand, we have the cross-in type, which is basically the esotropia. So we have exotropia, that is basically the cross-out phenomena, and we have esotropia, that is the cross-in phenomena that we'll be discussing over here. Then we have the other varieties such as hypertropia and hypotropia, as well as we will be giving you the additional classifications of strabismus over here in this very second section. In the third section, we'll be discussing the assessment in infants and in adults. So we have the both categories of patients. We have the infants at our hand, we have the age group between 6 to 12, and we have the adult age group who are suffering from this condition of strabismus. So how do we go about and assess these patients? We'll be discussing that over here in detail, and then the different treatment modalities that are present, we'll be discussing them out here. Eye patches is a very phenomenal kind of a treatment that is given over here. The results and the outcomes are very nice over here. So we'll be discussing how does it work out in these patients, and then the prisms. They are sometimes given out, prescribed to these patients. Why are they given? What is the mechanism of action of these prisms in these patients? We'll be discussing that over here. Then we have the non-surgical versus the surgical methods of the treatment of strabismus. What are the advantages, disadvantages, and what kind of surgeries do we perform in strabismus? We'll be discussing that over here. So I hope you want to learn more about this condition of strabismus. So do watch the other sections to this lecture as well.